Thank you. VC, you explained that, of course, we don't know when we will be able to open the university and return to normalcy, whatever the new normal is going to be. But what has come up is what plans are there in place in terms of things like social distancing, ensuring that we sanitize, wearing of masks. Are we thinking about some of those issues for when people can come back, even if it is a phased return to the university?
Yeah, my suspicion is there is going to be a phased return to the university, and as I'm talking, I'm going to ask Sudesh Sivarasu, our biomedical engineer, to in a moment talk about the work that he's doing with PPEs. But I think it's going to be a phased return. I think irrespective of whether the lockdown is lifted or not, I don't think it's going to be easy just to return masses of students and everyone on campus immediately. First of all, there's going to be a human factor that some people will themselves not feel safe enough to come on campus, and I think that's reasonable, given how the pandemic has unfolded. And we are going to have to rethink, and I've asked Professor Ferris with her team in student affairs to work on scenarios for residences so when we come back, so that we can have a scenario. If we have to come back, bring students back in June, what will it look like? How many per res, which residences, and how will we staff those residences and so on? We've got to think carefully about that. But whatever happens, if when the lockdown gets lifted, those of us going back onto campus, we will need to take extra precautions. Masks are going to be necessary, sanitizers, gloves. And I want to ask Sudesh to talk to us about what he's doing with his team in terms of this work, because my hope is that we don't have to procure these things outside the university, that they are produced on campus and can be used on campus. Sudesh?
Thank you, Vice Chancellor, and the alumni department and the alumni folks. With respect to medical devices related to COVID-19, we have formulated a task team, and we're working on a variety of medical devices. For instance, from low-cost phase visors to reusable N95 masks, and all the way to ventilators. So, in fact, our team has made an application to the National Ventilator Project, and we have been screened 2 levels by the National Ventilator Project, and we're going to be doing our final presentation tomorrow, and with the hope that UCT and with its collaborative team would be able to contribute to the larger ventilator need in the country. And we are pretty positive about meeting the requirements of technology in this COVID crisis, and specifically, around mass testing of coronavirus. We have been able to produce low-cost flock swabs in-house, and we are now in the process of making it available in a larger scale and going through the registration process and SAPRA approval processes. And that is the next step. And coming back to the Vice Chancellor's point about making locally available or in-house made personal protection equipments. We have successfully created disposable visors, and which can be made with almost limited resources at less than 10 rands a unit, and we will be rolling out these products starting next week. The product has been registered for SAPRA now and waiting for the final approval from SAPRA, and hopefully with that we should be able to roll out massive numbers of these personal protection equipments. Again, I would like to emphasize that in the efforts of flattening the curve, we should support the clinicians who are helping to flatten the curve by not reducing their numbers, which will have an inverse effect on the curve. So our primary focus has been about trying to support the clinicians as much as possible in delivering their services and to flatten the curve. And there has been tremendous support for this initiative, especially from across various schools within the University of Cape Town and also across different institutions where we haven't really worked in the past together, but now there's been a lot of interest and engagement with different stakeholders, and all of them trying to contribute to this larger problem around technology access in COVID-19. And we are pretty positive about making a real impact in this situation, and where we would like the alumni and the extended alumni support for these initiatives.
Thanks.
Thank you,
maybe if you can just say what SAPRA is, just for the benefit of those who don't always understand the acronyms, including myself.
Sorry, so SAPRA is the South African Health Products Regulatory Authority, which approves all the health related technologies that can be used on patients or clinicians.
Thank you very much. So, Vice Chancellor, I think we kind of coming to the end, and just two things, and I'd like you to maybe in conclusion. One is maybe you can share what the Faculty of Health Science is doing in terms of webinars, so that those who are interested in getting more in-depth knowledge in terms of the scientific health and research side, they would be able to benefit from the webinars. But then what has come up from many of alumni is they would like to know how can they assist the university during this difficult time, and maybe you could suggest some ways in which we would really value their support for their alma mater.
Okay, so thanks, Russell. So the Faculty of Health Sciences holds a webinar every Wednesday, and I'm sure Val and Ntobeko can talk more about it. But it's I think if you search for UCT COVID-19 Echo Clinic via Zoom, you would get that. It's on Wednesdays. It starts at 4 until 5, but it's every Wednesday. And so you get update information on the work that they are doing in the faculty related to COVID-19. Otherwise, you can also send an email to the alumni office so that they can send you more information on the webinars in the Faculty of Health Sciences. And I think in terms of how you can help, I mean, you know, I would say there's lots of things that are going to be different after this. As you can see, I mean, COVID is affecting the economy hugely. Student financial aid is our biggest line item on our budget every year. And I want to encourage you to give to the UCT COVID-19 Emergency Fund, because we are going to need to tap into that fund. Once we are done with buying laptops and providing for students who need them, there is financial aid that we're going to need. People are really, there's going to be jobs lost as the country recovers from this. Economists think that it might take us 18 to 24 months before we re-emerge as a country. And that will have impact on many of our students, and we would like to make sure that students who have an opportunity to come here can actually study here without any hindrance, and so your donations will be very, very useful. But I think more than that, I mean, the moral support that we get from you. I mean, I think the world is changing. I mean, I want to end on these general remarks that the world is changing, and I feel like I've been saying this since 2012. In many of my speeches, I talk about this changing world, and when people want to tease me, they say I'm pontificating about the world. But the world is changing. We have never seen anything like this before, and in many ways, it is the end of business as usual. Anyone who wants business as usual will struggle to find it at the end of this. In a way, we're going to have to rethink the university, as much as many systems around us are going to be having to rethink themselves. And so I keep asking myself, what kind of university is going to emerge out of this crisis? My view is that we as UCT are much better positioned, not just to survive this crisis, but to thrive through this crisis. And because of our strength, because of our history of excellence and the excellent people that we have in the university. But we've got to give up the idea that things are going to go back to normal. We've been talking about this Generation C being out there, and we are now in a way beginning to behave like it, work like it, and the characteristics, attitudes and values of Generation C are going to be some things that we need. We've been talking about skills of the future and the graduate of the future that we want to produce, and I think more now than ever before, it's necessary for us not just to talk about a graduate of the future, but the kind of graduate that we need to be producing now, who's able to deal with uncertainty, the kind of graduate who's not faced by rapid change, that they can problem solve and ride the wave as it comes. So I think there's a huge opportunity in this crisis. I don't only see danger, I see opportunity, and I think as UCT we can grab it. And I think someone wrote here in one of the questions, what's the best thing about being at UCT at the moment in this crisis? And I think one of the best things is that when you're in a university that's strong, that's got a history of excellence, a history of supporting vulnerable students, then you know you're in good hands. Our vulnerable students, hard as it may be, it is much better to be at UCT at this point than anywhere else. Thanks very much, Russell, and thank you very much for everyone who attended, and hopefully we'll connect again in future.
Thank you, Vice Chancellor, with those concluding and encouraging and uplifting remarks. And I just want to thank everybody who joined this live discussion. In the Alumni Department, we would really appreciate some feedback from you, whether you found this useful, whether you think we should have further live discussions, and what type of issues that you would like us to address. So thank you very much, Vice Chancellor, and thank you to all the senior leaders within the university making time available, and good luck to Ntobeko, Val and Sudesh, the wonderful research work that you're doing, and keep safe out there, and we will connect with you soon again. Thank you very much.
Thanks, Russell.